Hello
All right.
everybody. Welcome to the another episode of Royal College of Surgeons examination. And today I have with me Dr. Priya. She's my batchmate in UG, and currently she's in Malaysia having her own private practice. Hi Priya, can you give a short intro about yourself?
Hello. Hi, everybody. My name is Priya. I am working currently in Malaysia. I'm from Malaysia. I did my BDS in Ramachandra in India, Chennai, together with Dr. Vinay. Like he said, we're batchmates. After completing 5 years of my BDS, I came back to Malaysia and I served the government service in Malaysia. It's a compulsory requirement to serve the government service prior to working in private here in Malaysia. I decided to leave the government service about 3 to 4 years back and opened up my own practice here.
That's nice. That's nice. So Priya, I believe you have taken up the MFDS examinations, right, from the Royal College of Surgeons.
Yes, I have.
Cleared both part 1 and part 2. So
Yes.
today we'll be discussing about as to how you got through part 1. Okay. So my first question would be like, why did you want to do the part 1 exam? I mean, why MFDS? So then we'll go as to why we did part 1. I mean, how we did part 1 rather. Yeah.
Okay. So I basically was interested in doing oral surgery initially. So in Malaysia, you can't do it privately. You have to do it through the government.
Okay.
As in your seats and all go through the government. So they don't, and it's only the government universities. There are no private universities for postgraduate in Malaysia. So doing the MFDS, as when I wrote part 1, I took MJDF. There's a possibility to do MJDF part 1 and MFDS part 2. That it was there. I believe now that they have scraped off MJDF part 1. It's only MFDS examination. There's no more MJDF. So I did it as a requirement to apply for masters here in Malaysia.
Okay.
Masters meaning post-graduation.
Okay.
So the competition is of course very high in Malaysia because like I said, it's only the government university. So all these requirements, it just gives you additional points to when you apply.
Correct. So it gives you an edge if you clear this to get your postgraduate.
Yes, correct.
So focusing on MFDJ or house, am I correct? It's MFDJ, right?
MJDF.
Sorry. MJDF. So how similar is it to MFDS part 1?
So I think it's just so I wrote my MJDF like 5 years ago.
Okay.
So from then to now also, I think before they scraped off, there was changes.
Okay.
But I think the syllabus wise, it's almost the same. Just the examination pattern, the questions, the pattern the questions were set was slightly different. Okay. So one thing you have to know that this like now it's MFDS exams, they every 6 months or at least a year once, there's like changes to these examination patterns.
Mm-hmm.
There'll be slight changes, even part 1 and part 2, how they conduct, part 1 is probably like how they set the exam questions. Part 2 is how they conduct the exam. So both parts, they are usually like some changes. I think when I wrote it, there were 150 questions for, I think we had 3 hours at that point of time. Now I think it's 200 questions.
Okay.
And I don't think there's negative marking because there was no negative marking for me. I don't think there is now either.
Okay.
So these questions, the answers, they probably all will be right, but you have to pick the best option for the answers.
These are called as
that's how
MCQs, right? Or
MCQs, multiple choice questions.
Okay.
Multiple choice questions, yeah. They did, I think the older syllabus, there was some SAQs and all that. Mm-hmm. It was a bit different on the MFDS part 1.
Okay.
But then they changed everything now to become just multiple choice questions. All are just a standardized pattern now, yeah.
So MFDS part 1, if I'm not wrong, was more of basic sciences than clinics, right? Because part 2 will have your clinical sciences. Whatever we had to write as examinations in our final year. We have the various qualities, right? So can you briefly tell me?
So it's actually not basic sciences.
Okay.
It's everything. It's your basic sciences and your dental stuff also. Our dental syllabus as well.
Uh,
It is
like,
basically everything in one paper. All our 5 years in one paper.
okay, okay. I thought there'll be
Mm.
like a slight difference in the syllabus between part one and part two. It doesn't work that way.
No, so part two, you don't write an exam. It's like our Viva, you know. So what they
Okay,
do is they have stations. This is for
okay,
part two. They have stations. They have examiners coming down from, some will be local examiners, some are examiners from Edinburgh. Those Edinburgh examiners, I think only two or three. The rest will be your local examiners who are trained in this to be an examiner for RCS.
okay,
And then they will have about 10 stations and they'll give you like approximately 10 minutes each station.
okay, okay,
So they give you 2 minutes to read the question, and then the other 8 minutes there'll be a patient, but it's like a mock I mean, it's like you don't treat the patient, you just elicit the history, and then you do your case presentation. In that 8 minutes, everything has to be done. You have to elicit the history and you have to present the case, but presenting the case is to the patient, and the examiner sits there silently. You don't react with it. You don't have any conversations with the examiner at all.
okay.
In each station, you just sit there and you just so the patient will tell you, I have this problem, that problem, that problem, and then you elicit the whole history. Basically, the marking system is based on what questions you're asking, how you're arriving at the diagnosis, and you have to give a short treatment plan.
Okay. So it's
So
basically
that is
the
part
examiner
two.
stays there as an observer and assesses how you
Yes.
approach the
How
patient.
you, yes. So I then but that's very clinical based, you know.
Correct.
But then like part one, the theory is there for all the subjects. All our perio, endo, prosto, everything is there. Oral
Okay.
medicine, oral surgery, it's all there, plus our basic sciences.
Okay. Okay.
It's a mix, yeah.
So as far as the books or study materials concerned, for people who are watching, there are so many study groups. So even if you join
Yeah.
one of them, you'll be able to get access to all these study materials. So Priya, can you briefly tell us how you prepared for this exam? How much time is required for you to spend in an hour, in a day, or something like that?
Okay, the exams, I think the part one is not so difficult in the sense, if you there are a lot of past year questions, but of course past year questions meaning that you can't take the questions out from the exam hall. The question booklet is taken back from you.
Correct.
So I think those people who remember the questions, they go and
Based
upload
on
it
your
online.
memory. Yeah. Yeah.
So then of this, I actually joined this Facebook group called MJDF Part One, in which uh, there were a lot of past year questions, and of course it's repetitive. So and for many years previously also. So I think what I noticed was in my examination, about out of the 150 questions, about 99 questions were all past year questions.
Mm-hmm.
They had about 50 to 60 new questions. That's all.
Okay.
So the new questions are something that has never come out in the syllabus. So I think that is what they always add on to. So if you actually you go through these questions, from the questions you will know. I think before you start, like when you're planning, you can look through these questions to just gauge how much you remember, how much you don't. You can keep that as a guide, and also you can use back all the textbooks that we use for college. You know, I think it's sufficient, those textbooks, and like all our oral pet books also it is okay. Just that the things that are new that you have to learn is like the guidelines in UK. Like they have different guidelines. Let's say patients grievance, how do they, when you want to have grievance or
Compared
you
to
want to
anyone in their
complain.
respective regional country, the guidelines will be slightly different.
It is actually, I think, very much different from Asia.
Mm-hmm.
uh quite different, because I don't think even Malaysia it's slightly different, of course. And I think sometimes this grievance, you don't, when you're like purely clinical based, you maybe don't practice it much, right?
Yeah.
So then, yeah, so you have to keep up. So these things are what is like very new, something that you have not read. So those are what you have to keep yourself updated also, because if those rules and guidelines have changed, you have to make sure you have updated yourself
They're
on those
updated yourself.
guidelines.
Yeah.
Yeah, I
They're
think
also
you can
available in
obtain
the
it
website,
from
right? The guidelines.
yes, they upload it. They do upload it on the websites. So for these past year questions, the answers also that are given, usually on the group, you can on Facebook, you can just ask them for this question, what is the answer? Many people will answer you, but it's not necessarily it will be
Correct,
right.
correct. You have to go and verify
Uh,
it yourself if the answer is correct.
Correct. There is also, I don't know if you've heard, there is this Dr. Sana, which I think for part two, she's very helpful. I mean, people have taken classes, they recorded that and all. I think even part one, like in the UK and all, she gives training for people.
Okay, okay,
So a lot of people have uploaded those like questions and answers.
okay.
Like in Malaysia, I've seen there's a doctor who gives, there are a few of them actually who gives classes for part one or part two for these exams. So they probably have written it and they're quite good at it. So they give the classes. Maybe if it's very difficult, you can go to those. You can cross check with them. But I think if you just read up, like let's say you come across a question, like any subject for that matter, even if dental materials, if you feel like you don't know, then you just read up from your textbook. Because of course you can't possibly read up all the 5 years
Correct, correct,
text
correct.
and do this. Yeah. So that
That's what
I
I
felt like,
always been telling when you're preparing for an exam. You read the first subject, you move on to the second subject, and you go to the third, you forget two. I mean, you tend to forget the first. It is
yeah,
not
correct.
meant to remember everything. So you require
Yes.
a lot of revisions, right? Constant revising.
Yes.
Being in.
Yes, constant revising. But even that, you cannot be revising like all the textbooks, right? And also like, what are the percentage of questions that are going to come off from everything, right? They just pick randomly. So use the question bank as a guideline. You will know like what are they asking, and when you repeatedly see these questions, you will know that okay, so these are the kinds of maybe the like oral path and all. I don't think everybody remembers all the lesions unless of course if you've done PG, then you will remember.
Okay,
Like
okay.
in that particular subject, you definitely remember a lot. Let's say
Correct,
you have
absolutely.
like you yeah, you've done oral surgery. You probably don't remember much of prosto or ortho, right?
Very true,
Yeah.
very
So
true.
for yeah, for those you just look through, and also their treatment wise, they might differ. The way they treat might be slightly different from the way
Hmm.
we generally practice.
Okay.
So those things. They're also there are some questions like they'll give you some photos of a particular instrument. You have to know what instrument that is. So that's dental materials. And also, I think, I don't recall us using these instruments in India.
Mm-hmm.
So those kind of things you have to look up. Lah.
So, how much time did you exclusively allot for this per day, and how many months did you require to clear part one? Were you
Um,
working? Oh, sorry. Also, an add-on question: were you working simultaneously, or you had exclusively time to sit and prepare for this exam?
I was working when I was writing all the exams, I was working, but I used to study maybe about a few hours in the evening, let's say about 2 to 3 hours. And then during work, if I have free time and no patience, then I would
Mm-hmm.
sit and go through the questions. I wouldn't really study at work, but I go through more questions at work. I think it's easier that way. Study more at home. So a day, maybe 3 to 4 hours. I think if you prepare about 6 months, it should be sufficient. But I know of people who also have prepared for a year.
Okay.
Yeah.
So it's
But I
based
think
on a lot of
6 months is
factors,
all
but
right.
at least 6 months is required, right?
Yeah, at least 6 months, I think, should be. Because again, if you're
If
someone,
you're putting only 2 to 3 hours per day since you're working, it requires 6 months.
yeah,
However, if you're
six
exclusively
months.
preparing for this, probably the time will be a little more less.
Correct. I think you can do that. Yeah, you can. If you daily, yeah, should be sufficient
So, do
to
you have
run.
any idea about the prospects of what all you can do after MFDS apart from getting an edge, getting a post graduation in Malaysia? Anything else you know about MFDS examinations? Just an add on.
Actually, nothing much you can do with part one because in Malaysia we don't really need the part one to work.
Oh,
Because being a Malaysian, when you come back, you just put in all your documents, and then when they will allot you when to work, they will employ you accordingly. So it is not. I think giving you an age, maybe if you really sit and study thoroughly for the exam, then of course knowledge wise you are keeping in track. Your knowledge is there. Other than that, in Malaysia, not really. Not it's for the mostly we do it here is for our masters or for people who probably would want to go to UK.
Okay.
But I think for to go to and practice in UK, you have to write the OREs. So
ORE,
this is just the
correct.
yeah,
Correct.
nothing much. Oh, I think so. A lot of people write it because maybe qualification wise, when they go to a private setting, maybe it will look better on them. Qualification wise, it will look like you're a bit more qualified, maybe. That. Other than that, not much in Malaysia.
Okay. So to sum up, can you briefly tell in a minute as to what people should expect while preparing for MFDS Part 1 and how they should proceed, and just some tips? I know you've covered everything in the interview, but short and sweet.
Okay, so I think you just have to, the first thing is before you pay up for the exams, really decide when you want to write the exams, because there's no point paying up and then not.
Absolutely. Absolutely.
Yeah, that is one.
The
part
that,
one.
Sorry to interrupt. I'm sure the price of the examination must have changed over a period of 5 years, but how much was it when you prepared? Any idea? You could still remember?
I think for part one, I paid about 3,000 ringgit.
Okay.
With the exchange rate, it was 3,000 ringgit.
Which
so that was just
can you convert into either pounds or rupees?
Pounds, it was 1,000. It was about 1,000 plus. No, it was not. It's about 500 to 700 pounds at that point of time, if I was not mistaken. Okay. Yeah. So also the other thing is, once you finish part one and part two, and then you're a member, you would have to pay a yearly subscription of 700 pounds to extend your membership. Okay. Yeah. So yeah, to decide first, because of course these exams are not cheap. That is one thing, because of the conversion rates. Then you have to also prepare for your study materials. So I would say I spent quite a bit on, like, especially the questions. So financially, you need to prepare one. Second thing is, you have to also make sure whether you have the time to study. The third thing is, you have to look into why you're writing the exams. There's no point simply writing an exam. Correct. If it's really going to benefit you, then yeah. Of course, it's not waste studying for exams. It's never waste to study, right? That's what I always just say. That. Somewhere it will be useful for you. Yeah. Correct. Somewhere it will be useful. But I think, like, financial wise, for some people it might be to spend, because if you don't do your part two within 5 years of your part one, it expires. Your part one expires. Correct. So that's also important. You have to be able to finish off your part two within 5 years. 5 years. So I think financial, and then you have to manage your time. And then if you have both of these worked out, then you just have to sit and study. And from the studying point of view, I think if someone really wants to do the exam, they just have to put their heart and soul into it. Get your books. I'm sure everybody has their textbooks from school. From college, so it doesn't matter. The question banks and all those guidelines, updated guidelines, you can that you have to print out and start doing all those. And maybe it will be also good to have a support system, like a group of friends who are doing it, and you can discuss with them. I think that works well for part one and part two. Study partners. When you always study partners, yeah. Like for part two, I had a group of friends, so we all practice with each other. As of part one, there were a group of friends who I know. Then we would just cross-check our notes, and if you're not sure, we check with them. Maybe they know something more than you. So that would always help. Yeah, because you don't have the answers, right? The correct answers. So you can get confused as to what is the right answer. So these are the important things that you have to look into before writing this exam. Nice. Thank you so much, Priya, for your valuable time, and people watching this. So I guess you have a brief idea as to how to prepare for the MFDS exam, part one. And is it okay if I can share your email ID if people want to contact you? Sure, right? Sure. Yes. So I'll add it at the end of the slide, end of the session. So thank you so much, Priya, once again. Really nice talking to you. All the best for you. Very nice talking to you too, Vinay. All the best to you too. Thanks. Take care. Thank you. You're welcome. Bye.